The first coronavirus vaccinations have taken place in the UK, and what people are hoping is the beginning of the end of the pandemic. The UK was the first place to approve the Pfizer BioNTech vaccine for use, and 800,000 doses will be given over the next few weeks. Bevir has this report.
A 90-year-old grandma became the first person in the UK to have the coronavirus vaccine today. Margaret Keenan said it was the perfect birthday present just a few days ahead of her 91st birthday. Today marks the mass rollout of the coronavirus vaccine in the UK after it was the first country to approve the Pfizer vaccine for use. To start with, it's being offered to those who are over 80, to frontline medical staff, or to those who work in care homes. In the coming weeks, the criteria will be widened in terms of who it's offered to. The UK only has enough doses of the Pfizer vaccine for 20 million people. They're very much pinning their hopes on a vaccine being developed at the University of Oxford in conjunction with AstraZeneca. They're hoping that that can be used as a more widespread vaccination for the population at large. One issue with the Pfizer vaccine is that it has to be stored at -70 degrees Celsius, and therefore it was decided from a logistical point of view it was easier to set up these mass vaccination hubs like this hospital behind me and have people come here to receive the vaccine. The Health Secretary has today said that he's delighted the vaccination programme has begun, but has warned people in the UK to still obey the rules to stop the spread of coronavirus in the winter before mass vaccination has taken place. John Bevir, SABC News, Bristol.
And we also hope to bring you details very shortly about a very high-level discussion in Brussels in Belgium today. Members of all the major pharmaceutical companies that could be involved in the manufacture of various vaccinations discussing today and giving a joint statement. We'll bring that to you, but let's talk about vaccinations in South Africa and across the continent now. SABC News' foreign editor Sophie Mokoena joins me in studio. Welcome, Sophie. So, the UK, you know, people are already being given the jab earlier. We saw that 90-year-old woman get the first vaccination. There is a metaphorical queue, I guess, forming around the world as more vaccines are also approved. Where are we in our efforts to procure vaccines right now?
Well, Francis, you are aware that South Africa is participating in quite a number of trials in the country as part of an attempt to find a vaccine that can assist to manage this crisis of the COVID-19 pandemic. But also we know that South Africa has made a commitment to participate in the COVAX facility. The COVAX facility established by the World Health Organization, our president being the co-chair, where countries are coming together, putting together resources, and those resources are being given to pharmaceutical companies, scientists, who are trying to find a solution or to come up with a vaccine. And therefore, South Africa is supposed to pay its own fees or money in terms of its commitment to participate in that COVAX facility. But we were told that there was a delay. I spoke to a number of stakeholders who are working on this process of ensuring that we do pay our dues. I know that as we speak, there are 3 important stakeholders who are involved, who are going to ensure that we do pay. That is the Department of Health as the main department, Treasury or the Finance Department, and also the Solidarity Fund. As you are aware that President Ramaphosa established what we call the Solidarity Fund for COVID-19, and all the resources that are being donated to the Solidarity Fund were used to procure the PPE, but they have now agreed to assist in participating in the COVAX facility. And therefore, we hope that on Thursday, we will get a better information from Solidarity Fund, because they will have a press conference where they are giving an update in terms of what they have been doing. You know that business, ordinary people, members of parliament, political parties like the EFF have donated money into Solidarity Fund, and therefore the head of the Solidarity Fund, Glorious Robe, has taken a decision to ensure that he gives a briefing all the time in terms of where we are, and therefore we'll get better information in terms of how are we going to ensure that we are part of this COVAX. But you know that the president has made a commitment that definitely South Africa will not be left behind.
Well, COVAX is a great idea, Sophie. So countries sort of pool their procurement. They don't have to lobby the different manufacturers. They can get a bouquet, as it's called, of vaccines, and everybody gets a piece of the pie. But we spoke to an expert yesterday, a member of the Ministerial Advisory Committee on Vaccines, saying that the first one that's being rolled out in the UK, the Pfizer one, doesn't really help us in South Africa and surely many other African countries, because you need that cold chain and these incredible facilities. Could the logistics let us down here?
When you look at what transpired today in the UK, you can see that the issue of having the facility to keep this vaccine in a temperature of 70 degrees Celsius is a problem. That is why even the vaccination today in the UK, it was only conducted in hospitals where there are proper facilities to store the vaccine. They can't go door to door or go to specific areas where you have many people because of the same issue of the freezer that's needed, perhaps when you are in that institution to keep this vaccine safe. Now, but I think we cannot rule out the possibility to use this opportunity to demonstrate Africa's capability in terms of innovation. And we had we saw yesterday the reports that the Ethiopian airline is currently installing freezers that will be used to transport the vaccines. Therefore, Africa, people tend to undermine Africa's quest to be counted amongst nations of the world in terms of innovation, science, and expertise. And we have a young population on the continent, very up to the task in terms of using their brains to think. Let's take, for an example, the issue of ventilators. When COVID-19 became a problem on the continent, there was a concern that we don't have enough ventilators on the continent to assist those people who might be admitted in hospitals and need to be assisted, the issue of oxygen supply. But later, we are now aware that many African countries are able to manufacture such facilities, and it's part of building the capacity on the continent of manufacturing and industrial capability of the continent. And I think the African Continental Free Trade Area demands that as Africans, we must be part of the global village in terms of thinking and in terms of coming up with solutions. And we have young people who are capable, who are ready, who are part of this fourth industrial revolution. And what we need is to ensure that they have support. Governments on the continent must make resources available for training. They can even go overseas in countries where they can get better expertise. And I think we shouldn't undermine the continent. And this is what we are trying to do with African Continental Free Trade Area, that Africa is capable, Africa is able. Yes, let's discuss what's likely to be the challenges, but let us not look down upon people who are trying to assert themselves, Africans. And I think, much as I agree with her that we might have challenges, but I am confident that on this continent, I've traveled the length and breadth of this continent. I know, I interact with young people who are hungry for knowledge, but also who are hungry to make Africa one of the best regions of the world. And I am optimistic that we will be able to deal with that challenge.
Sophie, final question. This was on the agenda for the ANC's National Executive Committee as well, COVID-19 again. What did they say today?
Well, the president of the ANC, the president of the Republic, the AU chair, in his capacity as the ANC president, he indicated that the issue of COVID-19 was high on the agenda of the ANC, NEC, the National Executive Committee, the highest decision-making body. He even indicated that in the meeting, the two important ex-officio members of the ANC, that is former President Jacob Zuma and former President Thabo Mbeki, attended the meeting. One issue that they focused on was also the issue of the economy. And clearly, when you discuss the challenges the country is facing on the economic front, there's no way you can ignore the impact of COVID-19 to the economy. And therefore, reading a statement, and a person like Mbeki, of course, a week ago, 2 weeks ago, during the launch of the presidential library, raising concern around this issue. I think he went there to really make input in terms of what needs to be done to turn the situation around, because the country is in a crisis right now. And the president of the ANC then announced that one issue that they have agreed on is that the continent must be ready to take the opportunity to use this pandemic to build capacity. Let's take a listen at what President Ramaphosa, in his capacity as the ANC president, had to say. And bear in mind, he is also the chair of the African Union, but also the co-chair of COVAX. Let's take a listen.
This NEC acknowledged the important point about the need for the African continent as a matter of priority to also build its capacity to deal with COVID-19, but also to begin to look at the future, where through research, innovation, and also local manufacturing, we're able, as a continent, to manufacture our own diagnostic, therapeutic, and also vaccines, so that we should no longer continue to be dependent on other countries with regards to essential medicines, medical equipment, or a vaccine. We recalled as an NEC that the ANC has taken a decision that we should have a state-owned pharmaceutical company that would be able to enable this type of interventions to take place and be able to work with our sister countries on the continent.
We have quite a number of companies already in South Africa that are manufacturing medicine and drugs. And I think if one looks at what India has done on this sector, or in this sector, they have taken a lead. And I think Africa is capable, and we can do just that. And with the population of 1.2 billion, I think Africa is up to the task. Gone are those days where we were characterized as a dark continent and people with no vision. And I think I agree with the president that the young people who are involved in science and manufacturing, this is the opportunity.
All right, thank you very much. That was the SABC News' foreign editor, Sophie Mokoena.